We have talked a lot since the start of the pandemic about the spread of COVID-19. Today, we're talking about the spread of misinformation about COVID-19. Our 9 Health expert, Dr. Payal Kohli, joins us now to talk about it. It's been a problem for a long time. Social media platforms involved, they've even suspended some people for spreading misinformation. And you say some of them were doctors.
Yeah, it's crazy, Gary, because during the COVID-19 pandemic, anyone could put on scrubs, put on a white coat, call themselves a doctor, and essentially start to spread misinformation out there. So the WHO actually called this the infodemic, which is, the exponential increase in information, both accurate and inaccurate, that occurs during a global disease outbreak. And you can just imagine when we're consuming information online, how challenging it can be to sort out what's accurate, what isn't.
And how do you go about doing that?
Yeah, so it's very difficult. In fact, statistics tell us that just in 30 days, there were as many as 391 million YouTube videos about COVID-19 that were put up. So the sheer volume of information, I think, makes it challenging. I think one thing we have to do is really think about verifying the credibility of the source that's coming. And that doesn't just mean somebody who calls themselves a doctor, but it actually means looking at saying what type of website it's coming from. Is it coming from someone's personal account or not? Is it a verified account or not? One of the safest things we can do, obviously, is turn to our doctors and our healthcare providers, because we know that those are trusted, valuable sources of information. And then, of course, turn to organizations such as the CDC and the WHO. But I also think there needs to be some top-down regulation. I think that Twitter, Facebook, Instagram, TikTok, all of them really need to put in checks and balances in place so that people can't just post whatever their personal opinion is and say that it's science.
And call it, information. What is it about COVID-19? I mean, we don't see that many millions of misinformation posts about the flu, say.
It's true. Well, think about it. This is the first global health emergency, a pandemic, that we've really used social media as one of the primary sources of disseminating information. And historically, that's never been done before. It wasn't done during the Spanish flu, we can be sure of that. And so the fact that social media is kind of our main vehicle, as well as popular media, for disseminating information really allows people to share and with their friends and propagate misinformation in a way, sometimes not even realizing that they're actually being part of the problem.
And it can be dangerous, right? I mean, because a lot of people just take it for gospel.
Well, here's what we've learned is that misinformation costs lives. That during this pandemic, we've actually had people die because of misinformation or lack of adequate information. And I think the best examples are, of course, the immunization campaign, where there's a lot of misinformation saying that the vaccine changes your DNA, which obviously it doesn't do at all. So people were hesitant or afraid to get it. There's also misinformation that, masks don't work, which obviously for a respiratory virus, they work very effectively. So I've just seen so many crazy things out there. If you jump up and down 20 times after you're exposed to the virus, it expels it out of your body. I'm curious, what have you seen?
I've seen a lot of crazy stuff out there too. I can't recall any one, but I think the mask thing is the one that struck me the most.
And it's still persistent.
It's still persistent. If you wear a mask, you won't be able to breathe right, and this and that, and just all kinds of crazy stuff, as you're saying. All right, Dr. Kohli, always good to see you.
Good to see you.
Thank you.